This conference will now be recorded.
Welcome everyone to our Blood Cancers AnCan Kicking Cancer in Heels meeting this evening. I'm Michele Nadeem-Baker and I'm really excited to be here. I can already tell we're going to have a phenomenal meeting tonight because everyone's energy is like there. And we've already been chatting about some great things. So I know things I would never expect to be talking about in our blood cancers group like AI and yes, definitely expecting to talk about some of the other things, but let's see who needs some time this evening. And also, could my other mods please introduce themselves?
Hi, I'm Sally Torgerson. I have multiple myeloma and I am from Indianapolis, Indiana.
And I'm Lynn from out in West Texas, and I have small lymphocytic lymphoma.
And I'm in Boston and I have chronic lymphocytic leukemia, CLL. And also, as you probably have noticed the last few meetings, we've been missing one of our moderators, and that's Al Rubalcava. And he may drop in this evening, but I just ask that those of you who know him just kind of reach out and give him some encouragement. He's going through a bit of a rough time health-wise. He's been having some physical ailments, but also I know he had a checkup today, which if he joins us, he'll let us know about, or at least blood work today. So let's all maybe reach out to him because he's going through a lot. I think for, is it 3 months now? I'm maybe longer.
He was on the call about a month ago. He came in late.
Yeah, he popped in. Yeah, he was going through something then as well. I know he wasn't sure if he could join us last time, so I must have missed him on that last one. Oh no, maybe it was the one before.
It was about 2 months ago, and he came in late. Yeah.
So give him some big love from here. But I'd love to see who would like some time tonight. Jerry, I already know you would because we want to all hear more. So Jerry, I'm marking you down for needing time this evening.
I got something else too that's fascinating that I learned.
Okay. Leslie, will you need time?
I don't think so.
Okay. Well, if you do, let us know. I think,
Okay.
you know, it's always a delight to hear from you. Judy, I see that you do. Nancy? Will you need some time to share this evening? You always have such wonderful words of wisdom.
Oh, well, I'm good.
Okay. Sally?
No, I have nothing. Thank you.
Oh, and you've been traveling and at conferences? Okay.
Oh, if there's time.
Jim?
No, I do not have anything here to listen for my sister who has multiple myeloma.
Jim, you are the best brother. You're going to get the best brother award for sitting here with us in all these meetings. And and also later on, we'll ask you to give your group, to explain your group later on to those who may not know about it. And Bill, I'm going to go to you first because last time you needed to jump into another meeting you needed to jump off. And I know that that we have not heard from you to speak with us in a while.
Yeah. No, I'm doing pretty well. Been doing better over the last month or so than I was previously, so I'm good. I'm glad to be here.
Glad to have you here. Are you on, is it Calquence?
I was on Calquence for maybe a couple of years, and then I had some surgeries, had to come off it, and then I stayed off it. Went back on it, it was failing, and started pirtobrutinib, and I've been on that now for several months. Plus, I'm getting obinutuzumab infusions, and I've been feeling pretty good. I have a PET scan in about 2 weeks, so that'll let me know what's working, what's not.
Is Perto and Obin a trial?
No, it was approved in December, I think. It's I think it's a non-covalent, also known as Jaypirca.
Pirtobrutinib was approved, but pirtobrutinib with obinutuzumab. I was just asking.
No, I believe we're off-label. Yeah,
okay.
I believe we're off-label.
Oh,
there is a trial.
Judy is also on pirtobrutinib in the group. So you two may want to chat with each other about that and some of the things you've gone through. I don't know. Judy, do you have any side effects? Well, actually, you're not an OBIN, right? Just the Perto?
I'm just on the Perto, and yeah, I've developed some other side effects. Well, we think. This last month, I've had a lot of congestion and also a swelling of the salivary gland. But I had a CT scan. Well, on the 13th, I had head and neck CT scan, and then Monday I had chest and pelvic CT scan, and my liver showed clear compared to the last. But I think I'm losing some of my hair. I think it's thinning, and my fingernails are getting really brittle. So I think one of the side effects can be what do you call it? The upper respiratory, which is what I've had this month.
Yeah, I have my nails have gotten worse and worse with it, and I'm also, in fact, we went to the ENT. We have a new ENT doctor in town finally, and so I went to saw him yesterday. So yeah, I'm dealing with upper respiratory too a little.
Yeah, well, my salivary gland was so swollen on my left side, it looked like I had the mumps. And that's when they did my up head and neck CT early. And luckily it's come down. I had antibiotic and a Levaquin and a steroid pack for that. I had to be off of it while I was doing that.
So you took a little break from it so that you could have the other things done?
I had 2 breaks because I had the first part of the month was the upper respiratory and fever. And so they gave me a Z-Pack, which they probably should have given me the Levaquin. I went to the acute care clinic, and the Z-Pack kind of did something, but then my fever went back up with it. So I don't think it was strong enough. So.
The antibiotic.
Yeah, the antibiotic, yeah. So.
I'd forgotten about respiratory side effects being upper respiratory.
Yeah.
And Bill, you also have the obinutuzumab. How many months into that are you?
I forget what cycle. I think I've had 4 injections. I'm down to once a month.
And how many, is it the same protocol, 6 months as it is for?
I believe so, but I'm not sure. Like I said, it's off label, so I don't know what the doc will recommend.
So I take
I was offered a clinical trial just last week, and it's the second time in about 6 weeks. And the first one I enrolled in, but right before it started, they disqualified me for surgery I'd had 20 years ago.
Oh, wow.
So then another one was offered a couple of weeks ago or so, maybe less. And I just didn't, I was feeling pretty good, and I just wanted to keep feeling good for a while after I had such a rough time previously. I wasn't going to enter something new. And it was for a degrader, BTI degrader.
Degrader.
Those are like the new, well, they're not the newest, but they're the newest they've been offering to people.
Yeah.
But if you're feeling pretty good now in Calquence, I know you would, like you said, you had to go off of it. And then when you went back on it, it just didn't work at all, or it didn't work as well?
Didn't work as well. Yeah.
I've heard that can happen. And did your symptoms come back really quickly when you were off of it for your surgery?
Not in fact, about 6 months or more before I started hurting. I had a lot of lymphadenopathy in the abdomen, and it was pressing on my organs. And so I had a lot of pain there for a while. And so that's when we started the pirtobrutinib.
I look forward to hearing more about the combination as well. And
Yeah,
Judy,
me too.
yeah, and Judy, I know that would be interesting. You're just, I mean, the two of you can be our own study in a way, you know, that you're on just one and you're on both.
Yeah.
I take both as well.
Who?
You're
I
on
take
both,
both as
Leslie?
well. Yes.
That's
Yes.
right. I've forgotten about you also being on the two.
Yeah. They started me in March and I did the 4 once a week, like Bill. And then they put me on once a month. They've had to stop me twice. They just stopped me again last Friday because I've been having a lot of congestion that's been going on for about 3 months. Can't get rid of it. I've been on Cephalexin, Azithromax, and now they have me on one more. It seemed to calm a little bit with the first 2, but it came back. And it was kind of that army cough up in the morning, the army green, and then, excuse me, because that's icky. But it's just that really thick phlegm. And it just will not go away. My lungs are completely clear. They've done every lung X-ray, CT, nothing in the lungs. They pushed here, but the doctor, it felt like he pushed clear through the back of my head. So yeah, it hurt, but if I push on it, it doesn't hurt. So, he said, oh, it must be sinusitis. So he put me on this new, what is it? Vantin, which is cefpodoxamine. Antibiotic, and then he put me on all the allergy medicines, the inhaler, and all that stuff. And they did do a swab, and they found that there's cocci,
There's what?
cocci, COCCI, which
Oh.
can with the bars and the spirals, which can be a cause of strep.
Oh.
And so they just basically put me on this very strong antibiotic this time. And I still got, because the cough won't go away. I was coughing so hard that my throat was, the neck was swelling. The muscles were so swollen and sore from coughing so hard.
So
I hate to ask, but have they suggested just doing a salt rinse of your sinuses?
Yeah, I do that all the time in my mouth anyways. So I'm just gargling with that now.
Do a
But
salt rinse of your sinuses, though. Get it up in the sinuses.
Yeah, the nurse practitioner suggested a neti pot today.
Yeah.
So
Leslie, are you taking Perto?
I'm sorry?
Are you taking pirtobrutinib?
I'm taking the Calquence. I can't say the word. I just call it Calquence because that's.
I agree.
And then the rituximab injections.
Okay.
Yeah. So yeah, the same thing. Bill, Judy, me. It's all this junk after a few months that just doesn't seem to want to go away.
I've had that.
I'm glad I've heard this now because it's not just me.
And it's funny, you were calling it army. Yes, I just saw a picture on my phone from actually a month and a half ago from when I sent it, to my nurse. But mine, I took Augmentin for a month, and a few days later came back. However, I had laryngitis when it was like at its height. I coughed so much I ended up with laryngitis. I can't remember. I think we may have had a meeting. No, we had our meeting after that. I was supposed to go to DC.
Yeah, you still had a little.
Yeah, and that's why I couldn't go. That's right, because I gave it to you, Judy, over Facebook.
Yeah, right.
Through one of these meetings. So I guess I gave it to you too, Leslie. But Bill, I don't know. I don't know if I can take blame for you there.
No.
But so there must be something just going around.
Well, I call it army green, and I'll tell you why. And I know it sounds gross, and I'm sorry, Sally, but they say that when it turns color like that, it's actually your body fighting the infection. Mm-hmm. And so to me, that's an army.
Yeah. Oh, I like that.
Yeah.
Jim, you
so
that's why on that one, Jim.
Yeah.
I had the same thing in April.
I remember
How
when
long
you
did it take you?
Sally.
No, I was really sick.
For how long,
Yeah,
Sally?
I just have a comment. You know, with all of us talking about this, can you imagine if all that information was in Cure Hub? And so when they start doing clinical trials and looking for this, and you can add everything that you've done in trying to fix it and your side effects, add that to the information base so other people can know it. So get on Cure Hub and, you know, put your information in there so it's available to other people.
Well, also, and Sally, I had forgotten you were in Indianapolis. I'm going to be in Indianapolis the middle of October at the Lilly company is sending me there to speak, as well as to their things.
What are you speaking on?
On the Perto-Brutinib.
Yeah. Well, let me know before you, and if you need a place to stay, you're welcome to stay with me.
Oh, well, Lilly is paying for all of this.
Oh, then you're going to be staying at the Marriott.
Okay.
I know where you're going to be staying.
Okay.
Oh, I hope you
It's
two
in
get to meet
Minibar.
in person.
Well, just
But
out
at
of
least, you know, make some
curiosity,
time so we can at least have lunch or dinner or something.
Well, they have me scheduled out pretty much, but I'm also going to get to tour their plant and that kind of thing too. So I'm excited.
Tell them I'm your care person and I have to go with you.
There you go.
I would love to see the Lilly plant. Lilly supplied all the Pen V when I was doing my master's thesis, my master dissertation on environmental resistance to penicillin. This was way back in the 60s, so it's nothing new.
Yeah.
Lilly supplied all my penicillin to me.
I'm excited. I'm just going to be talking to them. They may even do an interview that I'll be like on their website and
Well, I'd love to get together with you if you have time.
well, we'll see. After the 12th, I should know more about what I'm doing. So.
Great. That sounds fantastic.
I have one question for everybody. One question for everybody. How many have you been told that's not a symptom of cancer?
Told what is not a symptom?
Anything that you tell them is bothering you that you've heard 100 other cancer survivors tell you they've had it.
It's normally the drugs you're taking.
Yeah.
No. I mean, like, you tell the doctor, they say, well, are you sweating? Well, my forehead and my underarms and my under breasts. Oh, no. You've got to be completely wet to be counted as cancer. How many of you heard a doctor say that?
Is a symptom, you mean?
That it's not drenching sweat, then it's not a symptom.
Well, I drench sweat.
How many of you actually sweated, but not drenching the sheet?
My hair gets so it drips.
You mean the definition of night sweats, their definition, which is
no, this is during the middle of the afternoon.
Definition of any symptom at all.
Any definition.
Symptom.
Any
They
symptom.
have talked to other cancer people and they have told you the exact same thing, but when you bring it to the doctor and they say, no, that's not one of the symptoms.
It seems to be, I know in CLL and SLL, and Leslie, you have a lot of the same symptoms, it seems.
Yeah, I have the lymphocyte mantle cell.
Lymphocytes, yeah.
Yeah, lymphocyte mantle cell. So mine was actually originally CLL, I was told, but it come to find out it wasn't. It was because it was lymphocytic mantle cell. Then that's why they thought it was CLL. So, you know, I find it just floors me when a doctor says, well, according to my textbook, that's not a symptom.
Well, it is a symptom if it worsens. I mean, to them, but it is,
Right.
but they all have that same definition, which I want to throw the damn book out the window, right? And it's got to be
Thank you.
Right?
Thank you. That's what I wanted to know. Do you guys get discouraged by that?
And I thought of that recently because I was thinking of doing a program on it, because I was like, well, you know, I mitigated a lot of this by having a cool, and we had talked about this, Jerry, with you too. I remember the mattress or the mattress pad how you cool and the pillows and the AC down to like frigid. Well, hopefully after all that, you're not going to soak through everything every night, but maybe if you didn't have any of that, you would. I thought about that
Right.
later. It's like, you know what? I should have just not done all that to be able to say, you know, I did. Did any, has
Yeah.
anyone else here
But,
had
but
those?
it does work and it helps. I'll tell you, it totally
I keep
helps.
the house at frigid and then I wear wool socks because my feet are so cold. Al's coming. Al's online.
Yay, Al.
Hi, Al.
The main of it is you have to be your own advocate, you know? I mean, I'll tell you a story that I had. It was interesting when I
I think
taught.
my doctor hates me. He never
I think
sees
you
Your own
scared
advocate.
Al away. There he is.
Hi,
Hello,
Al.
Al. Good to see you, Al.
Thank you. Thank you.
We miss you.
I've missed you guys too.
Oh, it's so good to see you, Al.
Thank you.
How are you feeling?
Well, not the greatest. I'll go back to sometime in the beginning of June. My left knee locked up like arthritis or sciatica or something. Then it went up my IT band and up my hamstring to my buttocks and lower back. And it went up my left side back. And then it went up to my neck. And then it went down my right side back, down my right leg. All this took place in about 5 or 6 weeks. One night, the pain was so intense. I told my wife, I said, just call the paramedics, call the ambulance, because I couldn't get in the car. And if we got to the emergency, I would not be able to get out of the car. And I told her, just call the paramedics. That's the only way for me to get down there, is they're going to have to wheel me in. And my son-in-law, who is an EMT firefighter, we called him and he says, you know, you're going to get down there and you might spend 6-8 hours in the waiting room. He says, you got all the medications at home. You're at home. You're going to be more comfortable at home. He says, take the medications and just write it out, which I did. But it went on for like about 2 or 3 weeks where I couldn't even lay in bed. I had to lay in a recliner filled with pillows, trying to find a comfort every night. And I couldn't do anything. And I don't know what it was, what happened. And I'm sending messages to my primary care in the portal. So he sent me to he gave me a referral to a knee surgeon. I told him, I said, I don't need a knee surgeon. I said, I need pictures of my back. I want pictures of my back. I want to see what's going on. Well, then he gave me a referral to a back surgeon. And again, I responded, I said, I don't need to see a back surgeon. I don't need back surgery. I need some x-rays. So I was finally able to, so I was finally able to get in with someone, and we got the x-rays. And what they found was mild arthritis in my lower lumbar. And, but I mean, come on, who doesn't have mild arthritis? And in between all that time, I know I needed to move because I was stiff as a board, not doing anything here and not being able to go anywhere. I mean, I haven't even driven a vehicle for like 2 months. My hair was really long, and I was able, my hairdresser was going to come to the house to cut my hair, but she had an opening one day and at her last appointment. If I could make it, great. If not, well, I took off. And in between that time, so like I was saying, I was able to find Luna in-home physical therapy, and they came to my house and they worked with me here. And I have a cousin who's also a physical therapist that works at a hospital. And I was working with a NMT, which is a neuromuscular therapist, and she's got 43 years under her belt from Canyon Ranch. And so she worked on my back. I couldn't lay down on the massage table, so I had to sit in her massage chair, and she worked on my back. And well, in between all those three people, they suggested that I get in the pool. So yeah, I was able to get in the pool, and I kept telling the therapist and my wife, I said, I might be able to get in the pool. I don't know if I could get in. And I said, if I do get in, I don't even know if I can get out. And so I did. I got in. It was 4 days in a row that I got in. And at one of those times, I don't know how or where, I never felt or heard anything, but I sprained my ankle and it swelled up. So I was icing it for a couple days, and that was my left ankle. And so that ankle's good now. And I have not been feeling well. So I have an appointment, which was a virtual appointment with my doctor up at Mayo. So I went ahead and did lab work yesterday because I was feeling okay. And I said, well, I better go today while I can make it. I don't know how I'll feel tomorrow. So I went yesterday and did the lab work, got the results this morning. We sent them in my portal. And well, they take forever over there. So I just got off the phone with them. But prior to that, I was on the phone with them about an hour before that. And my wife was on the phone with them first thing this morning. So after pushing them and nagging them, because I felt like I'm overdoing it on the hydroxyurea. And these are the same symptoms I had in 2020 in September when I went in for 3 blood transfusions. So I'm telling them, you know, I need to know whether to stop or continue the hydroxyurea. I said, this is where I was in 2020. I said, I don't want to end up in the hospital again and have another blood transfusion. I said, my numbers are right there. So the nurse finally called, a couple minutes ago, well, a little while ago. So they switched the virtual appointment to in person. So I'm going to go in next Friday and do my lab work and go in and see my doctor an hour after that. And if needed, depending where my numbers are at, after being off the Hydrea for a week, they scheduled a bone marrow biopsy.
Why do they need to do that as well? To see if.
Yeah, if there's been any changes.
It's called restaging.
Yeah.
So that's where I'm at.
Now, is this muscular or neurological?
I don't know. I really don't know. I have no idea.
Are these symptoms in line with PV or an MPN?
No, they don't think so. They've never, no. And the physical therapist, when she'd come over and do assessments, I was asking her, is this sciatica or what? What caused this? She goes, no. She says, you don't have all the symptoms of sciatica. So I don't know what it was, but I will talk to my doctor next week.
So they never saw a pinched nerve or a shifted vertebrae or anything like that?
A bulging disc, who knows? All they said after the x-rays was mild arthritis, lower lumbar.
I'm surprised they wouldn't have done a CAT or a MRI.
MRI, I would think.
Yeah, I have no idea.
I would think I would ask for an MRI.
That's how, well, when I had my back fracture, that's how they saw a fracture on an x-ray, but they needed to see the root cause of whatever, what else there might be and how bad it would, if there was swelling as well.
Yeah.
When I broke my sternum and collarbone, the x-rays at the emergency room never saw it. I had to have a CAT scan to see that.
Well, I got another appointment coming up with my primary care, so we'll be going over all this again.
Well, best of luck to you.
Thank you.
We're worried about you. You lost too much weight.
I lost 20 pounds, 25 pounds.
Wow.
Looks good on you.
Thank you.
We don't want him to lose weight that way, though.
No, that's the hard way.
That's the hard way. I will say though, because my grandfather had PV, and I looked into this because I remember that my grandfather had significant back pain, and they said his PV. Actually, about 50% of patients with PV have significant back pain issues. So that's something that's interesting. And typically they find it's a sign of progression.
Did you use
Yeah,
AI
well,
to get that?
I did not use AI. I used AJ.
She used Alexa.
I did. Not the
Here,
Amazon Echo, but
She used Alexa. That's what she used. Al, so they're cool with you backing off the Hydrea for the next
yeah,
week?
that's what they
Great,
said. Yeah, get
great.
off of
I'm
it.
so pleased they called you back like
Yeah,
they said they would, because it was making me nuts.
yeah. So the nurse sat down with Palmer's nurse practitioner,
Yes.
Jennifer Andres. They sat down together. They went over the numbers, and
Yep.
Jennifer agreed. Yeah, get off of the Hydrea. Now, depending where my numbers are after lab work, when I meet with Gene Palmer, that's going to determine whether they want me to do a bone marrow biopsy or not. It's
Right.
up in the air.
Right. Did they say what you should be doing over the course of the week if you don't feel good? Did they give you any instructions? Because your numbers are really borderline right now.
Yeah. No, they said, yeah, call them or don't call them and just go to emergency.
Just go to the emergency if you're feeling really crappy.
Yeah.
Because those numbers that that you shared with me earlier today, they're very close to like infusion needing numbers, as you know.
They're as low as mine.
You
You don't want that.
Oh no. Oh no. But I bet you take the 20 pounds that he lost, wouldn't you, Sally?
No, I don't want to take them. I want him to take some of mine.
Okay.
You think, that would be if we could only do that with each other, huh?
Yeah, Al, Leslie asked what your diagnosis is. She's a
Thank you, Lynn.
newcomer to join us. You want to tell her PV, and that stands for
Al. Yeah, Al.
He's frozen.
Oh,
He's frozen.
darn. Al?
Hello.
He's frozen and
We bored him to death. He went to sleep.
Yeah, no, there's storms passing. I mean, I'm about 30-40 miles south of Al, but there's storms passing through here right now. So yeah, we just lost him. There's monsoons coming through. So and he just got popped off. His diagnosis, Leslie, is polycythemia vera, which is an MPN, where you produce too many red cells. Because those MPNs, some of them are the red cells, some of them are the white cells, some of them are the platelets. They're all, I can never get them quite straight.
Has he tried leeches?
Come on.
Yes,
I'm
that's what they do. You know that, Sally. You go to the phlebotomist.
Yep.
And they just take your blood out of you. That's what they do.
That's right.
All right, guys, I am going to run over to the other group. I wish you all
This
well.
is so much more fun.
Well, yes, but I need the other group for myself. I'm going there for me.
Okay.
So we do have a request, which Alexa will make. I put something in the chat window. We'll explain to you, but we need you guys to step up for us, please. So I'll see you all later.
Rick, have a great month.
Thank you, Rick.
Bye.
So Al, can you hear us?
He's gone.
He left.
Oh, I thought
I can still
There, but he's
see.
not there.
Yep. Yeah.
He's trying.
He's trying.
There
very
he is.
talkative. Yeah, he's trying.
Are you,
I
Al,
can
we
see him
still can't-
blinking.
Where is he at?
Tucson, right?
Arizona. He's right near Rick.
Oh, in Arizona, they've got some bad storms down there.
Yes.
We're having thunderstorms.
I wish
Are
we
you? I wish we'd have something
Same.
besides
wish we
heat.
could rain. Yeah.
Al, are you having storms?
They're having monsoons. Yeah.
I think he froze it. Nope,
There.
it's back.
Nope.
Might have to put a message in the chat.
No,
He may have
Al's
to turn-
moving.
He may have to turn the video off so he can talk.
No, his video's on.
But yeah,
Oh,
the
for what
video,
channel?
because of the amount of data required, it may be. I see his lips moving.
Yeah, I went on, but I just get a like.
He's gone now.
Oh,
Frozen again.
I know.
What do they always say? Turn it off, turn it on. Have you tried powering up, powering down?
Well, they
Al, you
tried
might
that with CrowdStrike, and that did
Yeah.
not work.
Oh, yeah.
Al, you might turn off your video and see if we can still hear you if your audio come back.
That was a maybe. So, oh, while Al is trying and potentially frozen, no, he's not frozen. Why don't we go, Jerry? You had a few things to share, and also Al will come back to you when you stop freezing on us here. So Jerry, you caught COVID from your dentist.
Yeah.
That's really, actually, that's
I just encourage everybody, if you can get the shot in 4 weeks when it's available, I would get the shot, because that's the only thing, because all of your current shots are useless for this new variant. So whether you had 5 shots, you get 3 shots, other than perhaps keeping you out of the emergency room, perhaps, it does nothing for this. You need to get the new variant shot. So supposedly CDC came back and said you can get it immediately. But the problem is you got to have drugs fill the pipeline. So
Well,
that's about weeks. So I highly suggest you get it.
they now
'Cause it-
have the thing that's like what was the drug we were getting, and then they said it wasn't. The what?
It's the new one, Pemgarda, is that the name of it? It's like
Yeah.
Evusheld.
They said that is available now. It's hard to find, but it is available.
But it's not light for immunocompromised people.
It
Flirt.
is.
The flirt is not a light thing.
The what?
It's hard. It's when you're
Flirt.
immunocompromised. Yes, it's pretty good misery for about a good 7-8 days of misery.
Yeah.
The flirt.
Did you take Pavlaxid, or how do you pronounce it?
Yeah, I couldn't. My kidneys wouldn't take it. They said, "No,
Oh.
don't take it."
Because
said
I
no.
had COVID and it only lasted 5 days after I started taking that.
Yeah, I couldn't take it because of the chemo. I took the severe amount of chemo that they gave me. They said, with your liver and your kidney, you can't. Don't do it. But that's the first thing. Second thing that was interesting was I started getting migraines, and I was getting migraines after migraines. And I used to get migraines when I was a kid, and I used to get them every 6 months or so. So I was getting migraines, and I use Imatrix, which is an inhibitor. It basically used to fix the migraines, but I was getting rebounds, and I was going through like a 90-day supply in like a half a month. So I was getting migraines every probably 2-3 times a week, and pretty significant ones. And so I was trying to figure out, why did I get this all of a sudden? Was it because of I got the 22-year-old female DNA? Was that causing what was what was changing? And what I found out was I went to Gemini, Sally. And I came back and I plugged in what the effects were and what was going on. And I found this new research paper that came back and said that anybody that was on tacrolimus or sirolimus, even if it was 3 years out. So I had my transplant 3 years ago, and this stuff could pop up 2-3 years later if you were on an immunosuppressant of tacrolimus or sirolimus, and you could be getting repetitive migraine headaches and everything.
Wow.
And it's common. And what was interesting about it was also common amongst certain organ transplants as well, because they used tacrolimus for organ for anti-rejection stuff and everything. And I found this paper through the NIH, or it was just kind of an esoteric, but nobody really studied it and everything. And that started to explain what was going on. So I said, hell, I'm going to go to a neurologist and see what's going on. So I got CT scans and everything. So there was nothing wrong with the brain or anything. And what the guy put me on, the neurologist came back and said, well, tell you what, the regular stuff isn't working now because you're getting rebounds and everything, because it's more for acute things. So we're about to put you on something to prevent it from now on. And they put me on a drug that they use for people that spasm. What it was, an epilepsy drug that people use. Because I can't take the drugs that Lady Gaga, you see Lady Gaga singing about the migraines and everything. That stuff's like $1,000 a month. I mean, the new preventative drugs are $1,500 a month by cost, and that's with insurance. That's with good insurance.
Wow.
And so now I'm on basically a free drug that's for epileptics, and it reduced it. Now I'm down to maybe a migraine every 3 weeks, 4 weeks, but it really reduced it. But my only point of put on it is I use the artificial intelligence to come back and find out that, wow, this is a result of the tacrolimus.
Can you spell that drug you're talking about, that it's an after effect? Tacrolimus?
Tacrolimus and sirolimus. It's a very, very commonly used drug for stem cell transplants. So that
I had a stem cell transplant and I never had it.
Was it your own or was it somebody else's?
No, it was mine.
Yeah, I'm saying somebody else's.
Oh, so you had a donor.
So I had a donor for a foreign donor. So anybody that has a foreign donor.
So isn't that for host graft though?
Yeah, it's for host graft. If you have host graft issues, you don't typically have it if you're doing your own.
No, you don't have it. No.
A very close sibling, like a brother or sister, or something like that. But when you get somebody else's marrow or stem cells, they have to typically, 80% of the people have typically graft versus host disease of some form or fashion. So they have to put you on sirolimus, tacrolimus, pretty decent. And I had a pretty bad graft versus host. And so I was on major.
Yeah, that's one of the biggest problems in multiple myeloma is the host versus graft when they do the autologous. I can never pronounce it right.
I know. I hear you. You think I'd know it, Anyway, the donor. But I mean, nobody could tell me about that stuff and everything. And even with the neurologist didn't know really about it. And as I said, I use AI and I found this kind of esoteric, and it was a relatively recent paper from about 2 years ago that this person really drilled down into the information and came back and found that, lo and behold, these effects could happen 2-3 years down the road. Because I didn't have it when I first got transplanted, and I didn't have it, in that repetition. So you got to kind of, really look at the unique symptoms that you have, plug that stuff in, and then see what you get for it.
I've never thought of using AI for something like that. Wow. Now I'm learning tonight a few different things we've learned about.
And then I got one other thing that I just learned also was, if you guys got dry mouth, David's toothpaste. So what I learned about toothpaste is you want to stay away from fluoride.
Yeah, but you're supposed to use fluoride because like more than the usual person so that
No.
you're on treatment so that your teeth don't.
Wrong, grasshopper. What you want to use is you want to use, and I'll send you, I'll put some information. I just don't have it handy, but this confirmed this, and this was in the Atlantic. What happened is the Germans and the Japanese created another form that is not fluoride that the people use for their teeth for babies. Babies like to swallow toothpaste and everything. So when you're brushing your kids' teeth, they don't want you to use fluoride. And so what happens is there's another approved material that just prevents cavities. And what it does is it also has an enzyme in it, which is what you want for your teeth, particularly at night with dry mouth. And it also helps desensitize your teeth, and it's better for dry mouth. And I found this, and the problem is it's not ADA certified because it didn't go through the testing channels, but it's very popular in Japan, Europe, everywhere kind of but the US. And so what I did is I used AI, I typed in the formula, and lo and behold, there's a product called David's that you get on Amazon. It's toothpaste. There's other manufacturers, but in the New York Times, they came back and said, the wire cutter said this was the best toothpaste you could get. It whitens and everything. So I said, I'm going to try this, and it's damn good, and particularly for dry mouth. So it does give you the tooth protection. It gives you the anti-cavity. It gives you the enzymes. It gives you the it helps with the dry mouth. It whitens your teeth. I mean, it's fantastic stuff.
A lot of people don't know this, but there is a lot of fluoride in the water that we drink. There is a lot of fluoride.
Right. You don't need fluoride.
More than enough.
Fluoride dries your mouth out and everything.
Yep.
And then I came across a mouthwash that's also excellent. It's better than biotin. And I mean,
Biotin.
Pardon?
Biotin.
Nah.
Yeah.
Not good enough. Pardon?
I don't get enough from it. I use it and I chew the gum and I use the little spray I carry in my purse. And
wait a minute, hold on, I'll get it.
And it helps, but I still have dry mouth a lot.
Okay, for nighttime.
Ooh. These are like ads. These are like little ads, like unpaid for advertising here. Xylem.
You get it on Amazon. It's called Bio Extra. And this is better than biotin.
Really? Because I have terrible dry mouth.
Far better. Biotin didn't work for me. I had a little spray thing, you know, you had, and it's called BioXTRA, and it's ultimate dry mouth relief, and it stays. What the problem I got with biotin is it doesn't stay. You do it, it helps initially. I wake up, I'm a bone dry again.
Okay. This works really well at night. What you did is you have these tablets, and I take one.
Right, and that works too. It's sticking on.
It works great.
Yeah, and I do that. Actually, you know, I do that if I got a hack. If I got a dry hack or a cough, that same thing works very well with the tab in your mouth.
All the time, and also what it's made out of is supposed to be good for your teeth.
Yeah, xylitol.
Yeah, xylitol.
That's the drug in it. Xylitol.
Yeah.
Very good as well.
Get it at Amazon. $18 cents a piece at Amazon.
Yeah.
So, Judy, so that's what's available on Amazon?
Yeah, this is Amazon right now.
It's not cheap.
I get the 40 box, and it's about $26 or something like that.
This is like 18. If you let me finish, it's $18 on Amazon right now, which is 18% off, and there's an additional coupon for 10% off.
Oh, where's the coupon?
I need to order
Amazon on the Amazon site.
Ooh.
Just don't let your
Xylem
animals get a hold of it.
I wish I
My
would have known about this stuff when I was going through the chemo and everything.
TV
All
is
that stuff.
reacting to y'all every time you say Amazon because that's the magic word for it to come on.
Just
I'll tell you.
don't let your animals anywhere near that xylitol stuff. It'll kill them.
I
Yeah.
don't have animals, so.
Yeah.
Amazon, Amazon, Amazon.
Oh, it keeps clicking every time you say it.
I thought that was Beetlejuice. Beetlejuice.
I remember Beetlejuice. I love Beetlejuice. I just bought it.
So Jerry, you've given us great tips tonight. Sally, I cannot have two screens open at once when I have our meeting up. It will not allow me to also have something else up. Even when I should put one on the right side and one on the left, it keeps kicking off.
I just put them back. I put them back to back. So I just close one and open the other.
Or get your phone and do one.
Leslie, thank you.
Anyway, Leslie, I just bought a jar of 100 for $18.
Oh, okay. Yeah.
Oh, I haven't
I was
been
just looking at it and they have a bunch of them in here. So yeah.
bought the jar. I've just bought these that you push out.
I will tell you that the Biotine gum, if you chew the same piece for too long, that I don't know if this happened to anyone, but it kind of sticks to your teeth. It starts sticking to your teeth. And I remember being at Dana-Farber once, and I had my mask on. Underneath, I had maybe it's the heat of the mask. I have no clue, but it just like kind of got stuck. Anyway, I guess it was not fun at the time, but looking back, it was kind of funny. Because when I took off my mask, it got stuck to it. It was just not a good thing. But anyway, it was just other than this group probably would not even get it at all. Just watch out if you do use the gum. That's all I can say.
Dentures. I haven't chewed gum in years because of that.
It saves me with the dry mouth and having to wear masks,
Yeah.
without having to pull it off, put it back in. So we have Bio Extra, we have Xylamelts, David's
And
toothpaste.
David's toothpaste.
And good old Biotine.
Yeah,
Well, the best one is supposed to be this one that she gives is the Exley melts.
yeah.
Oh, that's not Xyla, it's Exley.
It's
Yeah.
XYLI melts, dry mouth.
I was saying it wrong.
Yeah, just make sure you put it in the front.
The ones I get it. It comes in sheets like this, which is real easy for travel. And you just tear off a strip and I put it by my bed.
But they're more expensive that way if you buy them in the jar. They're
Well,
less
I
than
know I haven't tried the jar just because these have been so convenient.
Anyway, I got 100 of them.
I've looked at that. I've been doing the pricing of it. So yeah.
Well, it's 18% off plus another 10%.
Wow.
If you
This
just
all
subscribe
sounds
to
great.
Dave,
And I get them tomorrow.
Oh yeah, don't forget your toothpaste, Sally.
Right. Oh, I already have $17 toothpaste that my dentist makes me use.
Yeah, I have that too, but I might try this one Jury was saying.
The only thing is because I drink tea, I needed something with a little whitening to it.
and that's
Yeah, and I
whitening.
drink
In it.
coffee.
It's whitening. It's whitening. It is whitening.
Wow,
The-
it
the
does that
Dave-
too.
The Dave's has whitening in it.
Yes.
Oh, okay.
Sounds like it does everything. I have to read some
Yeah,
papers first.
the New York Times rated it as the best toothpaste they've ever had to try. That just confirmed what the Atlantic came back and said as well.
Wow. Jerry, you are always a font of information on things like this.
I read a lot.
What else do we have to do?
It's waking up at 2 a.m, and then being retired, waking up at 2 a.m, and then not being able to fall asleep for 2 more hours or 3 more hours.
No,
You should have-
it's not going to sleep until 4 after your infusion with prednisone.
Yeah.
We should have a hotline. So when we're all up in the middle of the night, you know,
That's where you send your friends emails and forward stuff and everything. They think, wow.
When you catch up with cleaning things up on your computer.
I'm going to bed till
Well,
1 or anyway.
we'll have an impromptu AnCan meeting.
exactly. Leslie, what are you showing us? Oh, you found it.
Yep.
That's great, Leslie. I have to do that.
$15.99, and there's flavors.
Yeah, I just got the regular ones.
Mint, the mint's what I usually have.
Yeah, they have cinnamon, orange, pomegranate, raspberry, peppermint, watermelon, and wintergreen on this Nature Stance on Amazon.
What is it? Nature something?
Nature Stance, STANCE.
That's not the same thing then.
That's not the
No,
same.
It's Xylodent.
That one.
Okay, I don't know. I just looked up and that showed me this one too. So I guess you just have to see what if the
Ingredients are the same.
ingredients are the same or not. Yeah, xylitol, malic acid, magnesium stearate, natural red raspberry flavor, natural pomegranate flavor.
It was
That's all.
interesting. Somebody had told me about it, and I was telling my hygienist about it, and she had just gone to a conference where she'd gotten samples of it. So
Oh, of the one you're taking?
yeah.
Yeah. I was trying to see where the ingredients were on that one, and it's not showing it on Amazon for some reason, what the ingredients are. Yeah, that's weird.
The
They don't
ingredients
all.
are, I can read, my eyes are, won't see it.
I'll see if I can.
My eyes.
So
Huh.
while you're looking for the ingredients, Al, since we have you back, we can see you again. It looks like we're on your phone now. Is that what you did? Now we can't
He's
hear
muted.
you.
You're muted. You're muted, Al.
Okay, here we go.
I don't think,
All right.
well, it's good to have you back. So
Thank you.
you were saying your next step, when do you see your doctor next?
Next Friday. A week from tomorrow.
Wow. And you're going to be off your hydroxyurea all that time?
Yeah. Yep. Unless I start feeling weird or something. But yeah, I my experience with that hydroxyurea, that's what happened to me in 2020 is I was taking, what was it? 1,000 in the morning and 1,000 at night. And I don't know if some of you recall when I ended up in the hospital, and what happened was that I was getting my lab work done here in Tucson, and it was being sent up there to Mayo in Phoenix. Somewhere along the line, they were not getting my results. So every time I would go in for lab work, which was every other week, they weren't getting them. And in the meantime, I'm pounding the Hydrea. And I think it was within like, I don't know, maybe 2 months. I was not feeling well one night, and I had done lab work. So we called and we sent a message in the portal, and again we called the nurse up there, and she was able to pull out my lab work and called me back and said, you need to get down to emergency ASAP. Tell them you need a blood transfusion, that your hematocrit is, I think it was 4.5, I believe it was. And I did have an appointment with my doctor while I was in there, and they called me and they go, you're up you're running late. And I go, no, I'm not. And they said, well, you know, you have an appointment with Dr. Palmer here. And I go, well, that's not going to happen. I said, I'm in the hospital right now, which they were unaware of, other than the secretary who just sent me in the day before. And so the week after that, when I got out, I met with my doctor from Mayo, and I was telling my primary care, I said, I think I'm done with Mayo. I felt like I was forgotten about, you know, um, just totally, they forgot about me. And he sort of sat back and laughed, and he goes, you know, he says, we're all humans. We all make mistakes. Nobody gets in, not everyone gets into Mayo. You got in, he says, you need to stay there. And I said, well, we'll see what Dr. Palmer says. So by the time she came on and we had a virtual meeting, she was very sincere and very apologetic, and couldn't apologize enough, and explained to me that um, she was going to pull this up in their next meeting, because this is the prime example of what they've done to change the system due to COVID, and for them to go back to the original way they were doing it before. So I took a break from Hydrea when I got out. What was it, September? So September, October, November, December. I don't think I started getting back on Hydrea till, yeah, it was either December or January of 2021. And then gradually we started getting up there again. So right now I'm up to, we started with one, I believe, like every other day, but doing lab work. Then we added another one. And so right now we're down to where I'm taking 2 every day. So I think, I don't know. I'm not a doctor, but you know, from my experience and knowing my body, I think that's what happened. Is Hydrea just piled up and threw my numbers out of whack. And I could be wrong. That's why they want to do a bone marrow biopsy, just to make sure this is not progressing or transforming into something else.
Well, that's smart to check on that.
Yeah, but who wants to go through another bone marrow biopsy?
Just have it with sedation.
Yeah, they are. They are. But after
So
about
my
5 or 6
question,
of them,
yeah, my question to each and one of you: how many have each of you had a bone marrow? How many bone marrow biopsies have you guys had?
Oh,
8,
4.
8,
I think
Oh my God!
like Swiss cheese.
Yeah, yeah. Oh my God!
I don't want I don't want to compete with anybody on that.
No, I
too
know.
many.
And then my doctor goes, "You really want sedation?" I said, "Are you kidding?"
Yeah,
I said, "Obviously, you haven't had one of these."
Yeah.
my last
I'll
one
never
was
do
done
it
by a
without.
doctor and I never felt it. So
I'll never do it
That's
without sedation. They put me in the
so.
hospital for a week.
No way.
The
No
very
way.
first one.
I did
So
first
here's
one
the
with
other
a
question. Here's another question. I got to drive home about an hour and a half to 2 hours after that. Am I going to be okay?
No, you have
no,
to have one, you have
no.
to have
You're gonna have to have somebody drive you.
You
No
have
way.
to.
They
What
won't take you.
Yeah, my wife will
what's
drive me, but what about me sitting in the seat? Is that going to be painful?
No.
No.
No, you'll
no,
be
it
fine.
shouldn't be.
The only
Okay.
What
pain that I have is the thick cotton or thick gauze
Yeah,
pad they put
yeah.
against the seat. That's the only thing. So if you take a pillow to make it a little softer.
Okay, good to know.
No problem. That's no problem at all.
Yeah,
And who
also,
knows? Maybe we'll spend the night and come home Saturday morning. We'll see.
The next
it's
day's
better to
worse.
do it right after and not the
That,
next day. The next day you will be sore.
the next day's the worst one.
Yeah.
That's
I
the
yeah,
didn't
I
Yeah,
have
worst.
any
drove
problems.
Yeah, because you still have lidocaine around it.
Yeah. So I've
when
had
you're
one
coming home.
already. I had one already. It wasn't that bad.
I didn't hurt
No,
the next day except for if I laid on it.
the worst day is 2 to 3 days after, and it's because of the bruising. It's not,
Right.
any
Yeah.
other pain.
Yeah, I didn't have any bruising really. Yeah.
Sure.
I drove home after my last bone marrow biopsy, and it was local anesthesia, but they did have an IV. They probably gave me some forget-me-not medicine or something like that. But
Right.
Did you
Yeah.
tell him you were driving home?
no, I
Didn't
went the
tell him
wrong
you were
way.
driving home, didn't you?
I couldn't find where I lived anymore. But other than that, yeah, I had about 200-mile drive. So
That's a
And
How
long.
long?
they wouldn't let they wouldn't let us drive.
yeah,
That's
yeah,
all.
Yeah.
probably not a good idea to drive though.
Yeah.
No
No.
way. They wouldn't do it.
How long
They
did
wouldn't
you
give
have
me
a
any
drive,
details.
Lynn?
They say fine.
What was
Lynn,
that, Al?
how long was your drive?
200 miles
Okay.
Yeah. Ours is a
from Dallas.
5-hour drive, so we always spend the night.
Mine's 13 minutes.
Once an hour.
Hush, Sally.
Yeah, you
Michelle,
had a
I have some updates when my turn comes. I've got some updates on my
please,
two
please.
friends, one that has follicular lymphoma and the other that has
Mantle cell.
mantle cell. Yeah.
I miss him.
Go ahead.
Please.
Okay. Well, my friend with mantle cell, he's receiving bendamustine rituximab. He was on the call with us 2 months ago, and he's doing well. But my friend who has follicular lymphoma has lost 50 pounds in the last month. He continues to have problems with edema, with anemia, and getting blood transfusions, followed by edema and mouth sores and peeling of skin and so forth. The last time they sent him by life flight to Lubbock, they wanted him to be treated there at the burn center, and they said, no, you need to be treated in the wound care center. So anyway, he eventually got out, and he's back here in Abilene at a rehab center. And his doctor has said he wants to refer him to a bone marrow specialist in Dallas who specializes in bone marrow failure. So I did. He gave a name that sounded like Box or Bach, and I found a Dr. Bat, B-A-T, who is a bone marrow specialist at UT Southwest. So I'm hoping that that's where he's going to refer him to, because I think it's beyond the capability of the doctors here. He's had one round of BR, bendamustine and rituximab. He's had one round, and that was back in May. So this issue continues for him, and he's miserable. When I've been to see him, his eyes are all red and have mucus in them. He can't see hardly at all. So he's had some bizarre reactions. And my theory was that it was autoimmune hemolytic anemia, but kind of like what Al said earlier. What do I know? I'm not a doctor, so hopefully they'll get it ironed out and be able to proceed in treating his disease. I was looking earlier today at the bloodline that we get from the CLL Society, and there's some things there that I think probably apply to all blood cancers, the non-Hodgkin's, and it was saying that it's the heterogeneity of our disease that nobody's
Heterogeneity.
okay. So what Sally said,
Yeah.
that it's different for everybody. So there are things that we're alike, but there are things where we're different. So but
And it
that's
can
the
change.
update.
And it can
That's
change after treatment.
yeah.
Yeah.
And like
You have to restage sometimes.
I have to be restaged in 3 weeks.
So anyway, I hopefully I'll have some better news about my friend Billy next time around.
How are you doing?
I'm doing fine. Still on my drug holiday. I've been off of the Brutinib since March of last year.
Wow.
So I'm doing fine. I go back to see Dr. Wan on the 11th of September. So that think that'll go okay. I'll also be seeing the pulmonologist in October. I think it's around the 30th of October. So those are 6 month interval on those appointments. So we are going to go.
Congratulations.
Well, thank you, Feeling well, and trying not to take it for granted.
Don't.
Loving having strong fingernails. I mean, I'm very sympathetic because I know what y'all are saying about the weak fingernails, where you can't even open a jar without splitting it because you're on a BTK inhibitor. But my fingernails have come back crazy strong. But I can even open a, like on a pepper shaker, you got to open that little deal there. I couldn't do that because I'd have to get a knife to do it. Otherwise, it'd split my fingernail.
I have found that if I use lotion on my hands more, it helps the fingernails.
Okay, well, good.
I thought yours had improved, Lynn, your nails.
Lynn's have.
Mine are great.
And Judy, have you tried, there is a prescription they can give you. There's a nail thing, a nail polish. Well, it's not a polish, but it goes on like a polish. It's very clear, but the ingredients, it may have said shellac, or it was like shellac. I'm trying to remember which it was, but it's
not good for your nails.
They claim, I mean, the dermatologist at Dana-Farber prescribed it for me.
Oh.
And it reminded me of shellac. I do remember that. I can't remember if it had the same ingredients as shellac, but I just recall thinking of shellac when I used it, and it strengthens them.
I use a product called Hard as Nails.
The Sally Hansen one?
Yeah.
Does that help?
Well, I don't do well with any kind of polish because it breaks off so much. So I just haven't used it well. But I do know when I have used the lotion on my hands more, and make sure I rub it into my nails. If I do that a couple of times a day, it helps the nails.
I've been using one. I'll see if I can put it in the chat for everyone, if I can find it on Amazon.
I use Gorilla Glue for the splits.
Ooh.
It's Gorilla Glue.
Gorilla Glue?
Yeah, so because I get horizontal splits where it just splits down the set, and I use Gorilla Glue, and it'll keep it together, and it works very well, and it lasts for like 2 weeks, 3 weeks.
Oh.
It just reinforces it. You just put a little dab in it.
Put it on with a little brush or something?
No, I just put it like almost like like you're repairing a sidewalk. You just run a bead along it, and you blow on it, dries, and it's perfect. It really holds it together, because I mean I had all kinds of problems with it splitting and everything. And then I started using biotin too as well, the supplement.
Yeah, I have doing that. The only thing is I try to stay off of it the week before my blood test.
Oh, okay.
Because it does affect your blood test.
What does it?
Mm-hmm.
Oops.
Oh.
What does it do for your blood? What does it do on your blood? What does it do for your blood?
I've forgotten what it is, but I've just been told that it will affect your blood test being as accurate as it needs to be. So I've taken the hair, skin, and nails biotin, and I do that for up until the week before blood test. So,
But it does help, doesn't it? Your nails?
I'm on it about 3 weeks and then off a week. But anyway,
I didn't know that until you shared that,
yeah.
and I appreciate it.
Yeah.
Okay, I'm gonna send.
I use a lotion that Rotary House has, and it's called This Works.
I love that lotion.
Oh my gosh, I'm telling you what, I couldn't find a lotion to get rid of my dry. I was chapping here and down in between, and it was hurting bad. And I started using that lotion there. I don't know what it is, but it works.
Well,
It's
if you,
wonderful, but you can buy it online. It's
yeah,
called This Works, and it's helped my nails. It's helped my hands. They've never been this soft
Buttercream helps
before.
too.
What's that?
Udder cream.
Nope.
That's kind of what I do know which
Butter,
one.
butter?
It did not work. I tried the
Cecil or
coconut one. I tried everything. Nothing worked. I tried the hardest hand or the little
no, there's one
green.
called, it's hard to pronounce, Ceflatil, something like that.
Cetaphil.
Oh no,
Cetaphil, yeah.
no. This stuff was the only thing that helped. I
Well,
was just amazed. It's called This Works in bed. It does. It works.
Well,
This works.
if you
Yeah,
have
just This Works.
if you have eczema really bad, you can get lotion with urea in it. And if you
Yeah.
get 10% urea, and you have to order that off of Amazon, I couldn't find it over the counter anywhere.
Right.
No, you know what would be good is a list. We should have a list of stuff that we
That's what I'm
found.
making right now.
You get what I mean? And have a go-to list, because
That's
there's a lot of people that don't know about this stuff.
Yeah.
And then, like a FAQ, frequently asked questions, where you have a list of dry mouth, for sores, for this, for that.
Go to Health
And
Tree
then
and they have a list. It's called Side Effect Solutions.
Oh.
Ooh,
I actually have a list too, and I'm adding all this to it.
Fancy.
So
yes.
side effect solutions, that's a good name for it, Sally.
Solutions.
You'll have
So
to
what do
come.
you do for frizz then?
I beg your pardon?
What do you do for frizz and for hair that's turned into straw from treatment?
Use,
Patches that are going gone.
you
Yeah,
can use
that's
a hydrating conditioner. I bought the generic one at Sally's, and it's
Okay.
a hydrating that you can actually even use on your hair and not rinse it out. I mean, like after you get it dry, you can put a little bit in your hands and put on your hair too.
Right. Today I just took, after I washed it and put the conditioner through it, right before I got out, I just put a little more conditioner on my hand and rubbed it through and got out that way and left it on.
Yeah.
Because it's gotten to be like straw. It's terrible.
There's a
and
product called
clumps of it.
There's also a product called Caviar. You can get it at CVS, and it's a little tiny tube. You just use a dime nickel size, and after you wash your hair, just run it through, and it takes care of the curl, and it makes your hair really soft, and it's wonderful.
Yeah.
I had
no
problems with just regular shampoo, that I would get bumps in my head all the time. And
On your scalp, you mean?
Yeah.
Yeah.
And I was using the steroid solution and daubing it all, but then the dermatologist said, try the tar shampoo. And so now that's when I use the tar shampoo, which is not great, but anyway, when I use that, I don't get any bumps in my head at all.
What were the bumps caused by? The shampoo?
Evidently reaction to the follicle of the hair or whatever. You know, I would have some big bumps in my hair. Of course, that was when I was doing treatment too. But I've had some since treatment. But
I haven't had that.
Tar shampoo, I don't get that.
I'm trying to write down all these hints here. I put the one in about nails. I couldn't figure out how to put in the link to Amazon, but I put in the name of it on Amazon.
Yeah. That's all you need. Everybody has the link to Amazon.
Yeah.
Right.
I guess
You all put in the
we
exact link, which
we
I should have
could
done.
have a wish list for our group that you put on Amazon.
Yeah, I've like an Amazon wish list.
Yeah. That we could all,
Santa stocking stuffers.
And that
Yeah,
this
so do
work,
an Amazon wish list and then send us the connection to the wish list.
right, yeah.
Yeah.
I'm sorry, guys, but I'm going to bed because it's 9:30 and it's
so
past my bedtime.
I know, Cinderella, we don't want you to turn into a pumpkin, so.
Oh, and I don't turn into a pumpkin. I turn into a squash.
Of course you do.
Yeah, boy.
This has been a great evening, and thank you for all the suggestions, and I'm taking them all under advisement, and I've already bought 2 of them. So, night, night, guys.
Bye, Sally. Good night. Sleep well.
Who has not said, Nancy, did anything come up? Oh, Judy. I'm sorry, Judy.
But one other thing, I mean, I've had all these scans this year. It's ridiculous. But anyway, Dr. Awan did say today, he said, you need to think about hard about CAR T because we know that the PERTO doesn't last, but about 18 months is what they're finding.
Huh.
So that's one of the things I'm going to talk to Lily about when I go up there too.
Wait, what was that?
The
What are we not-
PERTO, the non-covalent BTK inhibitor, what they're finding is that the length of time for treatment before it starts failing is around 18 months.
Is that for everyone or just with your particular flavor? Well,
No, that's kind of in the research that they've found. If you go to any of the doctors making presentations on it, that's what they found with the clinical trials, that people start, to show a decline of it being effective.
And that's while you're taking it or after you stop taking it?
No, you don't stop taking it. I take it until it stops working.
Okay, okay.
But they're saying the stopping working is around 18 months.
so I guess we need to find out from Bill if the reason for adding on obinutuzumab is to make that last. I would think it would be.
That's in a clinical trial right now.
Yeah, he said it's just off label for him, but that's why I was asking if it was a trial. I think it is.
A trial of it. And I thought about asking about, adding that too.
Well, it's only been, hasn't been out all that long. They're still learning a lot about it from the trial, right? But you're one of the first people I know who's was put on it.
Yeah. So
how many months has it been?
I started the 1st of February, but I've been off of it pretty much off and on between my surgery and my taking antibiotic about a month.
So, yeah, I wonder if that month then you can take that off of the 18, it doesn't, you're not up to that. Yeah.
Yeah.
So, Nancy, I know that you said you didn't have anything to share, but since we're coming to the end of our meeting, is there anything that you've thought of or how have you been in your last month?
Yeah. I really liked hearing different, all the different things, and definitely bought myself some toothpaste. Thanks, Jerry. And, the thing that I guess I have a question about is one of the hardest things for me, and I was on obinutuzumab and venetoclax and came and finished my year in May. So I'm now June, July. I'm getting close to 3 months off the venetoclax. But whenever I stand up, or like if I've been in the car and I get out of the car, I'm like a 105-year-old person. Like I literally have this sense of agedness. I mean, it's just so strange. And then, once I get kind of straightened up and get moving, then I'm fine. But I just wondered if anyone else has had sort of that response where they just felt like they were really, really, and it's really only when I stand up after sitting for a while or being in the car, sometimes getting out of bed at night. It's just a real effort, and then there's like this real strange sense of being very, very, very old, and I'm 64, so I feel like that's, I'm curious. Maybe it'll get better, but anybody else have that kind of?
I have that, but I don't know whether it's age or the or the other.
Nancy, did you have this when you were on venetoclax, or is it since
No,
you've come off? Wow.
since I've come off. Yeah, I didn't really, but on venetoclax and all that, I just felt very weak. I felt very fatigued. And if Leslie were still on, the one thing, it was kind of funny because I went to a CLL specialist right off the bat, but one of the things he told me was he didn't think my fatigue was cancer related. And he quickly changed his mind, down the line, but that was one that was like, yeah, I'm pretty sure everybody I talk to in the meetings talks about fatigue. So,
And doing much exercise.
yes, I mean, as much as I can, but I am just building back. So I can go and I can walk about a quarter of a mile and back. I mean, Judy, you're the exercise queen, so this is not going to sound like much. I can go and I can weed in the garden for 15 or 20 minutes. And I stand when I paint. So
Are you staying when you're outside? Of course, it's related to getting in and out, but staying out of the sun, because part of all of these medicines in your system is they don't want you to be in the sun.
right. Yes. I wear a hat and I wear sunscreen
Yeah.
but yeah, that's it's just an odd, it's not normal for me to be, and to just be consistent. Every time I get out of the car, it's like I have to take a second and get everything back in and then start moving. And it's like as soon as I start moving, it's fine, but it's really odd.
Do you feel dizzy at all?
No, it's a joint pain. I mean, it's like a joint. It's like just stiff.
No pain?
Well, what
Because Claritin, I know for the side effect from treatment.
I take a Claritin every day.
Oh,
have you changed? Have you changed statin? My doctor switched me over to Crestor, and boy, I tell you, I thought it was because of the stem cell transplant. I didn't know it was because of Crestor. My God,
what's
I couldn't
Crestor?
get out of bed. It was like I was 95 years old.
Is the Crestor better or worse?
What?
Is the Crestor better or worse?
Worse. Oh, I went over to. I'm doing an injectable now for cholesterol.
They have it once a year now.
Pardon?
They have an injection for once a year, I think now.
Yeah, I can't. It's so expensive. It's like the migraine stuff. It's $1,000 a month. All that stuff is. You got to go through like 8 hurdles in order to even be considered in the insurance plans.
You hit the ceiling of where Medicare pays for it all. And next year
not on my thing, not on mine.
Wait a minute, so that's a statin, Crestor?
Yeah.
Yeah.
And did you go on something different? That isn't
Yeah,
that
I
isn't
went on, it's a new one. It's an injectable for cholesterol.
Is it once a month?
It's once every 2 weeks.
Oh, every
It's
2 weeks.
Rapatha, and it's free. And so I still have to I take a different kind of cholesterol, but like Lipitor and everything, I couldn't take that. That just, Lynn, that came back and that messed me up so bad. I would get cramps at night, joints and everything. And I honestly, I thought it was the result of stem cell transplant.
How long have you been taking the injection?
I just started it 2 weeks ago, so we're going to see what it
Okay,
does. But I mean,
see what it does, yeah.
but I ended up switching to a different statin, and then take this.
Jerry, Jerry, the thing is, I had the same thing on those two drugs, and there is a relatively new one out called Pravachol or Pravastatin that I got put on, and it is wonderful.
Oh, okay.
No pain. I was on the Lipitor, and the other one, okay, cholesterol was about 190, and the doctor says, hey, that's okay, kind of thing. Well, it wasn't okay, but so I had to stop them both. And so about a year and a half later, I got a new doc, and he suggested this Pravastatin, and it happened to not
Is it P or a T?
P,
P.
Papa.
All right.
Pravastatin, and the cholesterol dropped down to 138.
Oh, that's
HDL
great.
was up, LDL was down. The problem was the damage was done, and I had a triple bypass March 28. So
Wow.
I
Wow.
wish it would have come out sooner. Okay, and
Takes you-
the key was do stairs, about 10 or 12 stairs. And if you can't do 10 or 12 stairs, I would seriously think about a stress test.
I had a stress test because I ended up I thought I was having a heart attack when I had the blood clots when I
Right.
broke my hip, and they put me through a stress test and everything. But the one thing about the Rapatha is it cleans up your arteries, though. It's the one thing that
Yeah.
actually will clean your arteries. And so I'm going to see what this does, but I'm going to maybe I have to take another cholesterol med anyway with this, and so I'm going to look
Okay.
at this
Yeah,
combined
I'm
with
about to
that,
try it out.
the arteries, because boy, I'll tell you what, that Crestor just tore me up. I
Yeah.
mean, I was doing hot shots, these things to prevent cramping. That runners do, the triathletes, people that get severe cramps, and because it calms the vagus nerve, the
yes.
thing, the cramps, and it was vicious, and it was all because of the Crestor, and it was just a small, it was like 20 milligrams.
Yeah.
The Pravastatin, you
But it
said,
also gave me joint pain and all this. I mean, and back pain.
Nancy, do you take a statin?
You don't take a statin?
No,
Huh?
I'm just a leukemia patient. That's it. I got nothing else. I'm riding the wave. But I really like hearing that about the statins, because I think, cholesterol is always on a borderline for me. And so I'll get on that line and the doctor will say, well, we should talk about a statin. And my nutritionist says, well, let's hold back a little bit. And so they give me another year, and I come back the next year and I'm really good. And I don't know, right after obinutuzumab, I dropped like 50 points. It was like crazy. My doctors were like, what happened? but I do like hearing all that because I think it's important, just like so many things that were talked about tonight, just to sort of have a little sense of it in case I ever need to know, or if anyone in my family needs to know. So
Well, I
that's good
appreciate it.
information. Really good on the Crestor.
I'm like
Yeah,
Nancy,
it,
I'm on the borderline. My doctors brought it up. Maybe you should start on one. I'm just like, I don't want to go on anything else.
I don't either. I don't either.
you know what
But
you know what you can do though.
I do
The
have
deal is,
stairs,
you
so
get
I
a calcium
can do the
scan. Get a
stairs.
calcium scan,
Jim,
and
what's the
that'll
middle?
be able to tell you with the calcium scan on
The
whether you
calcium.
really need to go on a statin or not. That's what I would do.
Say
It,
one
it's
more time.
get a calcium scan,
You mean
and you have to pay for it out of your own pocket because they don't cover it. But the deal is that what a calcium scan will do is that'll tell you whether you need to be on a statin or not, and that's going to tell you percentage of clogging of your arteries and everything, of whether it's an issue or not an issue. Um, and that's probably the best thing that tells you, well, I should probably be on a statin.
Yeah.
And it's cheap. It's basically, I don't know, $50, something like that out of pocket. And it's basically 15 minutes, 10 minutes. But I'd probably do that if you're borderlining on a statin. Would you agree, Jim?
Oh, I'll tell you what, a triple bypass was no fun. Stents are easy to do if you catch them early. Stents are now like probably 15 to 20 minutes, and you happen to walk out of there and eat a gigantic breakfast and go home.
Yeah.
Yes, I mean, in the hospital, which was amazing. But unfortunately for me, the stents could not be plugged in. So I was referred.
On the Prevestatin, what's the milligram?
20,
20?
I think it is.
Because
Stand by.
I'm just
I
taking
got it right here.
10 milligrams.
They probably start you at 10, and then they work your way up to 20.
What do you
What do you got there? Lynn, hold that up again.
showing there?
You got the same thing?
Lynn, what are you showing?
This is atorvastatin, 10 milligrams.
That's what I take.
I went straight to 20.
Okay. Well, probably because of your bypass too.
Well,
While
no,
we're doing,
this was prior to it, about 2 years prior,
Oh,
but it was too late because everything was all clogged, and I did not realize I was on a bicycle. I was volunteering. Sure, I would get tired. I'm pushing 80. Well, actually, I'm 80 now, and oh yes, by the way, when you turn 80, you no longer have to worry about dying young. Okay? So anyway, I had to do stairs, about 22 stairs, and I crapped out about stair 8, and I knew something was wrong. But hey, the first indication was those stairs, because around here I don't do stairs.
But you have a
I do have some.
multi-story house.
No, me, no, a single story house.
Oh, do you? I thought it was
Right,
multi.
single story bungalow,
Oh, okay.
1932.
I have something for show and tell here. This is a book, and Nancy did the illustrations on it. It's
yeah.
Wow.
well,
How do we get one of those?
On Amazon, I think.
Wow.
We're going to have really big Amazon shopping lists after tonight. Like,
Get the paperback. It's the cheapest version, and all the pictures are the best in the paperback, I think.
Oh, really? That's interesting.
Well, the
Nancy.
Amazon version of the hardback has a mistake in it, whereas the one Lynn has is the artist edition, and it was printed locally at home, and so it is correct. So that version of the hardbound is good. but when we did the paperback on Amazon, they corrected, and so it has the correct. If you have someone, if you know someone in about 3rd or 4th grade, it's absolutely fantastic for elementary age.
What age? 4th?
Elementary.
3rd or
Oh,
4th.
I'm
I
gonna
learned
take it and
Ellie.
read it to my grandkids when next time I go there. It is dedicated to Zoe, and the book was written by our pastor's wife, and Zoe was a young girl that they adopted, and Zoe was probably already close to being a teenager when they adopted her. But the book is about children having a rough time. You know, children that have
Who is
Yeah.
been.
the author?
The
Jeanette
author,
McKinney. And Zoe had, and so many kids in foster care and that are adopted, a lot of times will have attachment disorder. And so the story is about really a horse with attachment disorder. And it's just it's kind of it was a metaphor that helped her. I got to do a lot of art therapy with Zoe when she was a teenager, and so it was just it was a great opportunity for me. I just absolutely felt like I was being used and on purpose, and um, just felt like all my gifts were coming into play.
I can't wait to get it. I'm going to send it to my grandchildren.
Absolutely.
Well, thank
Thanks,
you.
Lynn, for the ad.
I'm
Excuse
buying
me,
that
Michelle.
first before I buy any of these other things we talked about.
Excuse me, Michelle. Is it
Yes.
correct you are grandma?
Yes.
She's a
Oh,
grandma.
I never
Jim, a
heard.
grandma.
I would have never known. Oh, well, okay, great. Congratulations, grandma.
Yeah. Thanks.
That's a
They
nice
call me
grandkid.
Mimi. So, they don't call me grandma. They say Mimi. So
That's my grandma name, Mimi.
My
I'm glad.
grandmother was Mimi. You could not call her grandma. Had to be Mimi.
Mine's Gran.
Yeah, you never know. Oh, here is the link for the book too. I'm so excited. I know, Nancy, I've been waiting to hear about the book. So I'll
It's
send you.
fun. Yeah. So on Thursday nights, we in Vermont for the next, like for 6 weeks in the summer, Thursday nights, they have bingo over at the community center. And we play with the really old bingo cards and little plastic markers and stuff. And then if you take baked goods, you get in free. And that's the prizes for the bingo or the baked goods people. But you can also bring, so I've taken a couple of books and people have been able to get my book as a bingo prize.
Ah,
Oh, that's
Oh,
nice.
that's a great prize.
Yeah.
You should have them. I wonder if any of the little local stores there would sell it in the area. I have to check
You
this
know,
out.
Vermont is very, I don't know. When you read the book, there's some scripture in the back of it. Vermont is not. It's hard to know who would be open to that. So
Like New Hampshire.
I do better just donating. I give the books to the school and to the libraries, and that way, I know that maybe they'll get in some young person's hands and be a blessing.
Yeah.
It will. Well, everyone, thank you so much for being here with us. It's been a really enjoyable meeting where we've all learned so much. I mean, it's really, this has been fabulous for helping each other. And I'm going to compile a list of some sort here, and maybe I'll do a video on it so we can all have it, and maybe AnCan can post it or something.
And then Michelle, just one more thing. I'll post it in the chat. we need a couple more reviews for our great nonprofit seal that we get every year. So if AnCan has helped you out, it only takes maybe about 2, 3, 5 minutes. If you could post just a really quick review, that would be really, really helpful, and we would appreciate it. And you found a new toothpaste tonight. That's something you can talk about.
Talk about a lot more than that. I saw
There
that
you go.
email today, and it would be real. That is a great thing. Do you get any extra credit if you get more than needed? Do you move up on the
Absolutely.
list?
How do you post one?
You just click the link that I put in the chat. You don't have to sign up, get an account or anything like that. You just click it, you just write a review, then you're done.
My eyes are not doing well today.
I'm with you, Judy. It's the dust.
Having a hard time reading this stuff.
Well, if we just copy and paste, that's what I do. I copy it and paste it into my notes. Thank you again. So our next meeting is, hold on, unless you know, Alexa, off the top of your head. Let's see.
Whatever the first,
It is September 5th.
and
So see you all September 5th. Same bat channel, same bat time. Great seeing you, Jerry. I hadn't seen you in a while.
Yeah, I've been bicycle. It's bicycle. Thursday night's bicycle night.
So, but I hope your COVID goes away really quickly. For me, it took a long time.
Yeah, I know. I remember you struggled a long time with it.
I did, and I've been waiting. I'm due for my vaccine, but I've been waiting for the new one because I'm like, then I won't be able to get one, and I want the new one. So
Yeah, I would get it as soon as you
well,
get
once
it.
it's available, absolutely. I'll be one of the first ones in the door.
Yeah.
I just hope it happens before I go on vacation in a couple of weeks.
well, and the to try to get, I don't know about getting the immune thing that they have now. That
I would get the flirt because the other vaccines are fine. You'll be immune. You've got enough immunity. The others, you have no immunity to this new one.
She's
So
talking about
all the old shots really aren't going to work for this new one.
it's the replacement of Evishield.
Oh
Yes.
yeah, I don't know about that one yet. Yes.
Yeah, I was in the pharmacy the other day, CVS. There were 2 people ahead of me wearing masks. I said, "Y'all don't have COVID, do you?" And they said, "Yes, we do." They were picking up prescription, and I was the next person in line after them. Yeah, I told them I appreciate you wearing the mask because I'm immunocompromised.
Well, and then wipe everything down too.
So I was meeting my wife for lunch, and I washed my hands before lunch. So
this new one is really.
Well, they shouldn't have gone into the pharmacy with it. They should have done the drive-through.
yeah,
That's what
so
I always do.
I was touching the same keypad that they were using. So.
Well, you know what I do is I take a wipe with me so that I never touch the keypad or the pen that you have to write with. I always hold it.
This is also airborne though. This one's an airborne one, and it's really highly communicable.
I always lick my finger and then do it.
You know what I do is I bought one of the little, I don't know if it's a stylus or whatever, the little, like the pens they use on the keyboard, and I'll use that. But I like your idea. I guess we have to be careful. Yeah. Back into hypervigilant, not that I've stopped, but.
No, I didn't stop. I never stopped.
But the dentist,
I still got it. Yeah. That's what freaked everybody out because I'm so hypervigilant. And if I got it.
You ought to call the dentist office though.
Yeah, I'm gonna.
Good night,
All right.
Nancy.
Night, everyone. Have a great night.
Good night.
Take care.